Much gratitude to the presenters tonight who are going to talk to you a little bit about how we prepare clinical vignettes and research for abstract and poster presentation. I will tell you that when I first submitted my first abstract and gave my first presentation, I had no such formal training. And man, am I embarrassed about what I did. It was pretty terrible. So you guys are already way ahead. You're not going to make the mistakes I made. We have wonderful presenters for you. And we're going to start first with the clinical vignettes. And so one thing I'll say before we start with the clinical vignettes is that always surprises me every single time I go to a meeting. I love going to meetings. I find them really stimulating, interesting. It always surprises me, the clinical vignettes that are presented. And I think, oh, I could have done that. I've seen something similar to that before. So that's one lesson I hope that you'll take away tonight, is that it doesn't have to be the world's most unusual diagnosis ever, but sometimes just a twist on something common can be really a useful teaching point. If you learn something from taking care of a person, chances are you could present that in a way that other people can learn too. So we'll start then with first talking about the clinical vignette abstracts. And I'll turn things over to my colleagues, Dr. Keel and Dr. Kausar.
Hi, welcome everybody. Just give me a second to share my screen. All right. I hope you all can see that. My name is Sapna Keel. I am a program director in transition at Ascension St. Agnes Hospital in Baltimore. And my colleague who will also be presenting is Dr. Kausar. Dr. Kausar, would you like to introduce yourself?
Hi, good evening, everybody. My name is Hamim Kausar. I'm the inaugural program director at Tidal Health in the Eastern Shore of Maryland. So I'm kind of remote. And I'm in this job for about 3 years now.
Wonderful. So everything hopefully you need to know to present a clinical vignette at an ACP meeting for sure. And anybody feel free to chime in. Dr. Kausar and I will tag team through this. So writing a clinical vignette, when you look at medical communication, this is one of the oldest and most familiar ways people talked about things they saw. Here's something interesting I saw. Have you seen it? What do you do about it, right? So in some ways, was the beginning of before we had the research and our ability to gather information and present, it was case or case series. And so that's really where we are. And many of the times, it's an original observation, working one-on-one with a patient and presenting it. Of course, there are some rules, and we'll talk about them as we go through. I think what is that? We talked a little bit about this, but it can be as rare as a new disease entity. Especially in the world of COVID, we had quite a few new things that were happening that nobody had seen before, and COVID manifestations and things like that. But basically, it is a case that tells you about an unusual or a prominent feature, even of an established disease. We'll talk a little bit about how to formulate the vignette. And this is the biggest question we get. I don't know, is this case rare, too rare enough? Has everyone seen it and I'm the only one who hasn't? So it can be sometimes difficult, and this is where your mentor can be really helpful. Your program faculty can give you perspective, but the bottom line, as Dr. Christmas said, is that it can be a common disease, but could have an uncommon presentation or have a twist, have some unusual complication, something that was new or different, and you learned from it, and your colleagues would learn that too. What would you say, Dr. Kausar?
I totally agree with you. The main reason is to share your knowledge and experience, because it can be a common disease coming with uncommon presentation. So sharing that information with other people is to promote knowledge. So that is what it is. It's mainly to share your knowledge. You publish it so that other people have a similar case can learn from it.
Yeah, and sometimes it's a different diagnostic strategy. We usually do an LP, but I didn't know you sent for this new antibody that nobody had known before. And look at how we can diagnose this disease, which used to be a clinical diagnosis, but now we have new diagnostic strategies for this, for example. So moving on, can I use the same clinical vignette for different meetings? Yes, you can, but there's a caveat. It depends on the different meetings and what their expectations are. You can present original work at the chapter meeting here with us at Maryland, but you have to check what the requirements are for different societies. So just double check that. Of course, the other question is, what about the title? Is the title important? Absolutely. As people walk by, many posters on that day, sometimes it's a catchy title that draws them in to say, let me see what this case is about. And so try out some interesting ways to present that. And sometimes people keep it a secret. Maybe you don't want them to know the diagnosis right in the title, and you want them to figure it out. Hamim, other thoughts?
I agree with that, because you don't want to disclose everything, but you want to make it such that people become interested to know more about the case. So be innovative, because that will attract people. If you say everything in the title, then there's nothing new to learn from that. So you may lose some audience. So I agree with that. The first point is whether you can use the same clinical vignette or same case in different meetings. The first question I will have is, why do you want to present same case to many meetings? Do you want to write it in your CV? Do you want to write that you presented the same cases in 5 places and you want to write 5 times to make your CV longer? Smart people will catch it right away, that you had only one case that you presented 5 times. You actually will not get a lot of credit for doing it. If I am reviewing your CV, that will give you a discredit, that you have one case you presented 5 times.
I agree. And the other thing we see is authorship of case reports. Sometimes I see the entire team on the case report, but the other people may not have worked on on writing it up, doing research into the case. So it's not just the people who are involved in patient management. And it's important to recognize that just because your friend wants to be on the case doesn't mean that they should be on the case, right? So be thoughtful about that. It's important. And the first authorship matters as well, because typically the first author presents the case at ACP for us. But again, things to think about as you present. Typically, because of the volume of abstracts we get, we have restricted submissions to one clinical vignette per individual. So that's the primary author or the one who's going to present that case typically. What are the sections? Well, typically for the abstract, a short description, a short intro, a little bit of the case description. And please, this is where you keep it short and sweet. This is not just copying and pasting your H&P here. It's only the pertinent things that you think are important. Often bulleted makes sense when you get to posters, but here you're giving just a short description. And then a little discussion, maybe a couple of lines on why decisions were made or whatever your take-home or learning point is from the case. And we'll share a couple of examples, so we'll walk you through that. Anything on this, Hamim?
No, I think you covered the points. So in the abstract, when you write the abstract, you want to write the relevant information. But also one thing that I see frequently missing in abstract, if you write an abnormal value, we don't know what abnormal value is. We don't know what is the normal value for that, right? Your abstract may be reviewed by people who doesn't frequently do things that you do. So it is a good idea, or maybe the unit may be different from one place to another place. So we don't know. If you write an abnormal value, it's a good idea to write in the parenthesis what is the normal value so that we know how abnormal that is. So that is one of the things I frequently see missing. Also, in the abstract, please write the units. Don't write hemoglobin 10, right? So that is incomplete. So from scientific standpoint, you should write the units and what is the normal value.
Okay.
Thank you.
So what else do I need to do? Well, abstracts must be reviewed and signed off by your program director before submission to ACP. And your program director is the one who submits them to ACP. There is a specific format and a page that will be sent to you. I will share it in the next slide. Font cannot be reduced to 5 to fit it all in. So keep it at a reasonable size. It's time, you start with more than one page and you cut it down to the pertinence. That's important. And just as we mentioned, here's an example. Here's what the submission sheet looks like. I've just blanked out the names here, but I thought this had a catchy title. And let me show you just the screen looks. Here's an intro, there's a case presentation and a conclusion. So if you want to read it, I just have it here so it's a little bit easier to read. And the intro is about oxalic acid. What is it found in and what can happen? Here's a patient who ran into trouble because they were having so much iced tea at CKD and ran into trouble. So it's a nice little interesting case, and you can see how everything's kind of kept short, but has some of the points that Dr. Kawsar was making. Anything here?
No, I think this is perfectly written. You have these units, you have what is the baseline, month prayer. So I think that is good. So you get an idea that what we are looking at, how it is changing over time.
And then here's another checklist, is some way to kind of organize your process. When is the due date? Because I think a lot of people do it last minute. And if you can keep that date in mind in your smartphone to remind yourself ahead of time. The copies needed isn't so relevant here, but who's going to be the author so you guys can meet or collaborate ahead of time. If it is from another institution, affiliations, lesson of the case, making sure that it meets the word limit requirements to fit into the formatting box. We don't have a word limit, but we have the formatted box. And here's another example. This is at HLH, but it was due to SARS-CoV-2. So a couple of years ago, this was a big thing. And as you saw, diseases that you hadn't been presenting in this different scenario could come up with a good case report here. So again, has the very pertinent things. Of course, you're not going to fit everything you will put in a poster, but this is just that brief, abbreviated, to the point presentation. And I think that's all we had. Any parting words, Ami, for them?
No, I think one of the challenges for SCP submission here is the template that is given to you. So you can always make it shorter, keep the pertinent information. You don't need to make it a smaller font to fit in. I think if you have the right information, your abstract will be accepted. Don't, there are information that you can skip, do that, keep the important information. And I think all abstract will be accepted, isn't it? Or it will be, I don't know how it works, the acceptance in a SCP meeting here.
So for clinical vignettes, it's actually one clinical vignette per individual from the program. Of course, the program director has to review the vignette, make sure it's appropriate, written appropriately. And so sometimes you may be going back and forth with either your program director or whoever in your residency is designated to help you with it. So that if this is the first time you're doing it, it may take a few tries before you get it right.
Let's move on then to the, let's say your abstract got it admitted, got it selected. Yay, congratulations. Now you have to figure out how you're going to present this information. And we're going to talk about how you put together a poster that focuses on clinical vignettes or patient stories. And so for this portion, Drs. Dabin Chow and Dr. Maria Martinez Cruz are going to talk about that.
Okay. Hey, I'm Dabin Chow. Thanks for joining us. Dr. Martinez Cruz is also presenting this with me. She's going to do the bulk of the work. I'm taking the credit, however. So if you like this presentation, you know where it came from. We're going to talk about putting together your poster. Here's some hints, some suggestions about a template for your poster. One is, don't necessarily need to put the abstract on your poster. The people who are reading your poster, they have your abstract in their packet. You don't need to copy and paste your abstract onto the poster. Have a sense of flow. We're going to talk about it. Usually the readers of a poster will look from left to right. And make sure you include some learning objectives that the reader is going to take away after looking at your poster, and at least one take-home point. How do you know if you have a great poster? This is the measure, is if the people who read your poster walk away and they go home and they're going to change their practice. Some way, somehow, that their practice has changed because of their reviewing your poster and learning from you. And so use that as a lever to decide how you're going to put your poster together. Include some references at the bottom that shows that you looked up some stuff related to the content of your poster. Now, Dr. Kuhl mentioned about authors. Now, if there's people who contributed but didn't necessarily contribute to the level of being an author, you can acknowledge them. And so you could have a little section of acknowledgments, and this shows that you're a gracious and kind person. Use the same font throughout, and use the same font size throughout the poster. This is not the abstract box, the poster itself. So usually for our meeting, a font size of 24 to 32 is usually pretty good, depending on the total amount of text that you have. Now, there's headings, and of course the font size for the headings can be bigger, whereas the smaller text that's in the materials that you have can be smaller. But keep the font size consistent, so that's not distracting. One thing that I have the sort of my own pet peeve, I guess. Make sure that every table or every figure in your poster is labeled. So it's figure 1 or it's table 1, and then refer to them in your text. So if someone is looking at your poster, they're not having you present, they're not having you listen to it, but they're just reading it. They'll know when to look at each figure. They'll know when to look at that table, because it'll refer the reader to that in your text. Okay, be careful about too much text. You can use bullet points, graphs, pictures, and another pet peeve I have is using acronyms. Be careful about acronyms. You may think that CKD, hey, everyone knows what CKD is, right? In a way, if you put CKD, it's sort of like jargon, and just take the effort just writing chronic kidney disease. It's not going to kill you, and it just makes you look more professional. Avoid trade names and avoid medical slang, and we'll talk about this more. Dr. Martinez Cruz, do you have any additional comments about this?
Yeah, thank you, Dr. Chow. And I mean,
I give you all the kinetics for the slides and everything. I'm just here like kind of like supporting. So all the credit to you. Yeah, I think like also for the design, it's also important to choose the font. I think the fonts that we usually are good, especially like in graphic design perspective, is Helvetica is a good one. Arial is a good one. Helvetica New is also like Helvetica overall is my favorite. And also like when you like try to as Dr. Chow mentioned, like you shouldn't like I know we distribute the poster like introduction, case description, and kind of like discussion, and you can then not necessarily put like kind of like the titles, and if you put the titles you can use boxes or kind of like some visual appealing stuff. I think that will also we have examples of that, so we can show you more.
Okay. All right. So here's a poster. Hey, what do you all think about this poster? It's a cool case. It's lung mucoepidermoid carcinoma. You don't see that every day. I've not seen any comments in the chat.
Too much text.
Too much text. Yes.
And font is way too small.
Yes. And it's painful.
Yes, and that picture at the bottom, what is going on?
So they have expanded. They have overstretched that picture and they have not kept the original parts of it. And they do that for the CT, PET CT too.
Yes.
I don't know why they got two reference sections, which is kind of odd. And I like to hear other people's comments about putting references on the actual poster itself.
So, Dr. Chow, is it a real poster or he made it up?
This is a real poster.
Oh, no.
Yeah. Yeah. So I guess what I didn't have any input on this poster, but what happened was they wanted the columns to line up. So the middle column, they stretched the picture to fit the size of the column. Hey, that's not good. You got to the pictures of the picture. So right. So there's a lot of problems here, and this might be a great case, but gosh, this poster didn't. The authors didn't do themselves any favors here. All right, good. So those are a lot of good comments there.
Yeah, and also in this case, like for example, they try to show kind of like a long lesion. It would be nice to put a kind of an arrow or kind of a circle or kind of like guide us what you are trying to see. So if a person is walking, I mean, you can kind of show what do you want us to see in the CT scan or the PET scan.
Yeah, Maria, if someone was walking, they're going to walk past this poster, right? It's not something you can stop and look at. Okay, here's another poster. Okay, now notice the title is sort of catchy, right? The Cost of Sobriety. That's a catchy title. It's you might pause and think about that. There's a cost to sobriety. I don't know, Dave. That's a new one, right? All right, now. Well, the thing I wanted to point out here is notice that what is the flow? So your eyes look down the column on the left. Then you work your way across the bottom, the middle there, and then you go down the right column, and that's sort of and that takes you home. So this poster does have some flow to it. Now, there's a chart in the middle which I want to call your attention to. It's the timeline, and when you have sometimes you have a case in which the patient's been in the hospital for quite a while, and here the patient was in the hospital for 2 weeks, and it's hard to describe a hospital course of 2 weeks. Have a little graph like this, and then as you're describing the events, you can point the listeners to where you are in the timeline, and they can follow you more easily. A timeline is a nice a tool if you have a patient who's been in the hospital a while and they have a complicated hospital course. Maria, you have any comments here?
No, you cover everything.
All right. So let's
just to mention here. I mean, I like the flow exactly, and this one used bullet points, which makes it easier in your eye to also follow me.
Oh, good. Yeah, thanks for pointing that out, Dave. And so you'll see that let me go to the next slide. And so here's a poster, and just the font size and the font here they're the same size, and then they put the headings in bold. Now you can make the references smaller font. Definitely do that. The acknowledgement, the references, they can and should be a smaller font, but make sure that your regular text of your poster is consistent in its font size. All right, now this was something that you'll see in meetings. They want to catch your attention. They think that the meetings might have 500 posters in this big huge room, and the authors are afraid no one's going to stop by and see their poster. So they want to have an eye-catching poster. So they do this thing where they put the main message right up front. They hope that the main message is one that captures the imagination, the attention of the people walking by. It draws them in. I don't know. What do you all think? Do you think this is a good technique? Do you think this is useful?
So I would say what I liked best about this was the imaging, and I got some good feedback about what imaging to put in there. So the imaging catches your eye and the message catches your eye. And so it is a way of making you look at the images also, because it's in that red spot. So your brain goes to the red and it looks at it and then look at everything else. And then thankfully, the font is either yellow and white and red, which also helps because that doesn't glare too much. And they have done the helpful arrows for all imaging. I would have liked to see helpful arrows also in the A figure, just to make it even better. So from a visual standpoint, this is an eye-catching thing, but not everyone likes these fonts. So
I'll say I really like these. So I put a comment in the chat about being a profound introvert, and that, that's part of why I don't like a lot of words, because I don't want to get stuck at the poster and for risk that someone's going to speak to me. You go to these huge meetings and they might have hundreds of posters, and you can't stand there and spend 10 minutes on one. You're going to miss all the other ones. So I want to kind of cruise by this. I can tell right away what they're talking about, and I'll be like, oh, I had someone with cysticercosis once before. Let me read this one. Or, oh, that's not at all interesting to me. I'm going to go on to the next one. I got the gist right away. Next one. So I kind of like the punchline right in the center, front and center. Then I know whether I want to engage or not engage with that poster.
Dr. Chow, I have a comment. I didn't like one thing, that title having two different colors, and you are boarding it and then color change, and other words are not colored. This is too heterogeneous. I think if it is one color, you can board and keep the same color, same format, instead of, in the title, board one, not board one, italic, underline in the title. I didn't like the title, how it is written.
One thing I would like to mention quickly, this author has matched the university colors with the poster color. Like, it represents University of Maryland theme.
Oh, there you go. I didn't even think about that. The only thing I would say is I wish that you see at the very bottom here of the column in the left side, head CT. I wish they would have said C figure A, because these are head CTs, A, B, C.
No. Figure A is a brain MRI.
Oh.
Please. Yeah, I'm sorry.
head CT/MRI. I wish that they had. Yeah, I wish that they had
more clear.
Yeah, more clear there.
Yeah.
If they just said MRI only, or if they just referred to the figure and not even mention anything there,
Yeah.
that'll save them some more space too.
Yeah. Yeah.
Okay.
They should have just mentioned figure because they confused everyone here because this is an MRI, this is a CT.
Back to the title comment, I actually disagree. I really like that they highlighted some of the keywords for the poster. So if I was interested in cystic fibrosis or if I was interested in seizures and stuff like that, like the keywords really pop out to me because of the way that they emphasize color. So I know that maybe visually it's a little heterogeneous, but for me it's like, oh, this is like what the paper is about. And if I want to know more, I would stop and read it, just as Dr. Christmas was saying. Cruising by, getting an idea.
Anyway, you're going to see these in your meetings. It's a popular approach. I guess it's the younger generation approach. Okay, let's move on.
I just wanted to make one last comment. I think what you're hearing is the differences in how people see things. So sometimes, yes, we may agree on some of the fundamentals, but there is a lot of variability in our stylistic or fashion sense or whatever, our color sense, how we like things. And that's okay. You do the best you can.
Although sometimes, always when you're submitting something, look at the guidelines for submissions. Some of them will have a format that they want you to use, and you should absolutely follow what they want, if that's the case. And then others just tell you the size of the poster board or that kind of thing.
Okay, great. That's this. By the way, the author here. He's a very flamboyant guy. He's a very flamboyant dresser. He's a yeah. So this sort of fits his personality. All right. I wanted to show this poster because this was a patient who had a pretty complicated clinical course, ranging 4 months prior all the way up to 7 weeks afterwards. And as they were going through, and as you go through hearing the case, the focus here was the timeline. And then when you got to week 4, he would draw your attention to this image. And we got to week 7, you draw your attention to this image. So I thought was a good technique in that as you're presenting the poster, you're focusing everyone's attention on this timeline. And as you're going through the timeline, then you come off the timeline, use the other materials in your poster and describe it, then go back to the timeline. So this is another technique, and I thought it can be useful for a case that has a lot of that's a long time course. So Maria, you have any comments on this?
Yeah, I mean, that's a really good technique. I think like posters should also like be kind of like reflect your personality in a professional way. I also like colors, graphics. I don't like a lot of text like this, but you need to put enough information just to, attract the attention for the poster, and they will ask you questions and you can just sell your case, because at the end, this is how you sell your case, and you need to sell the case with vision or visual graphics and with your presentation skills.
Okay, we're coming up against the time. And the only thing I would criticize this poster, it's hard to know what the take-home message is here, right? There should be in bold what the take-home message is going to be. Okay, here we have an outstanding poster. Maria, you want to discuss this?
Just quickly, like, I mean, I tried to design the poster. Like, I like to combine the colors with my logo, that is Midstar. And as you see, like in the discussion, I really don't like a lot of heavy text. I mean, the poster like didn't like kind of like the format was desegregated. But a good case, like the way that I tried to catch the attention from the judges was with the discussion and the pictures, right? And I mean, like having like a like a kind of like a eye-catching title, and then like having kind of like a explaining like with a graphic the discussion. So when I presented this case, everybody was like, "Oh, what's your pheochromocytoma?" And they start seeing the graphic and start asking questions. And at the end was really helpful, like to get a position. So my recommendation is like you can separate the sections, like the pictures, try to alienate them. And I mean, this is my style. I also like colors, but other people can do other stuff. But yeah.
Okay. Well, I know we're up against the time. We probably ran over. Thank you all. By the way, this poster was an award-winning poster. It was not only well done, it was well presented, and it was the final one of the finalists, if not the finalist, in our competition last year. Okay, I'll stop sharing.
Thank
I
you
think that
so
brings up
much.
the important point about the presentation, which I think trumps the poster, is how well the presentation is done. So a well done presentation. You can tell when a resident's involved and engaged, and this was their patient, and they want to just tell you about this amazing story. And that's exactly what Maria did last year, or 2 years ago, right? 3 years ago. How long ago was that? I can't remember. But that's
Let's
exactly
keep
right.
moving along. So next we have discussing research abstracts, Doctors Deepak and Bajwa.
Dr. Bajwa is going to talk. I'm here just for his backup.
Sure thing. Absolutely. Good evening, everybody. And thanks for having me. I'm Omar Bajwa. I'm Chief Resident at Luminous Health Internal Medicine Residency Program. And with me is Dr. Janiki Deepak, and who will be telling you guys about how to write research abstract. So thank you very much. Thank you, everybody, for joining. And I see a few people from my residency program as well. Dr. Fargai is there, so hello. And our interns are there as well learning. So thank you, ACB, for hosting. And we'll get started. I have no disclosures for this, and I will start right on. And what I want to give our learners here is a bigger picture that in research abstract, what are the essential components, and what are we portraying information there. So first of all, starts title and author information. And here I would like to mention is the same point is here, portray yourself fully and kind of make attractive and sell yourself, make your product a great product which is catchy for the people who are here to see the other presentations. So the title should be interesting and dramatic, and you can just make it more attractive for people. Like, for example, if you compare these two things, if you give numbers, it puts more attention. Like 100,000 people each year die of this problem rather than important cause of mortality is this. So whatever puts more weight there, portray there. Next would be, so obviously the main purpose in an abstract in a limited space, we want to portray and tell the judges that what are we doing. So regardless what comes up, important thing to think in your brain is what are you telling, and what's your research is adding more, what is unknown, and how your abstract is adding more to that information. So think in your brain before writing that what are you portraying. So that's very important. So as you know, title should be succinct yet descriptive. So it can take many forms, but try and make it try to dense the title, but you should be able to still convey your message. That's the intro. And then if we go next, is, this is a generic, some rules. Always check where are you presenting and where are you submitting. They might have some specific requirements, to please make sure that you are doing there. And now next part is the methods. And when you write research abstract, it's important to talk in methods that what is the research design? What is the design of your study? That's number one. And also, what is the setting of the research? And the further, it will be patient in rules. And if we talk about research methods, broadly, there will be the prospective studies, retrospective studies, try to mention them. And the bigger picture would be, the two big questions will remain that what is your exposure and what's the outcome? We'll talk about that in the further section, but in the methods, we'll describe our study. So if you go next, and as I mentioned, what intervention we did, and we will describe that in this part, and then we'll analyze the data. And the next section in research abstract is results. And the major thing in results we want to mention is, first big thing is we'll describe patients or people who were included versus excluded. And if they were excluded, why they were excluded, we'll write about them. And it's an important thing and core component, I would say, in abstract, we would like to mention and compare the outcomes. Whatever the outcomes are, they can be, as in the bracket shows, that treated versus untreated, young versus old, and genders. We should mention the outcomes by comparing themselves. So that's results. Next, please. And now, when we talk about results, it's always a good idea. It does not fit on all requirements. Some people, may not like it, or they would not require. But it's always good to put in a table and the results. And table gives you option that you can portray the data in a small form, but give a big picture. And we should also mention about the statistical significance and standard deviations, which we see there. And I think that's all here. And the last part is conclusion. And in conclusion, our writers should always mention the things which is supported by data. And whatever their research is, it should be supported by data, and they should portray here that these are the findings. And the last part is important. At the bottom, it's always a good idea if you want to generalize that result to the community. If it fits there, it's a good idea. And after going through the basic components of a research abstract, I would like to mention and share some tips. First of all, I would say the biggest one is practice. Practice. We all learners here, and the more you do things, and the more better you get. So it's always a start. You will not start as a perfect, but the practice and repetition matters, especially for residents who are doing the first time. So start early. It takes time, but put your effort there. Mentor, very important. As my talk before me, all people who are program directors have mentioned, great tips. But experienced mentor, reach out to your mentors in the residency program or wherever you guys are. And just whenever you make it, show it to them and give their feedback, go back, improve it, show it again. So work with the mentor, very important. Revisions, as I mentioned, that's part of revision. And so you can always, a good idea, people share your abstract with the people who don't know what are you doing, and just give it to them. They can be your judge. And ask them what are the thoughts. So they can be your judges before the actual competition. And I think that's all. Next. Yeah, checklist. Always, this is a checklist I got from my mostly source of this presentation is ACP website. They have nice resources there. Always good. Make a checklist and make sure you're meeting all one. So it's a good idea, as we mentioned in the poster presentation before. Next slide. Yeah, this is a sample abstract, and it gives you a bigger picture. What are they doing and what are we writing? And I will go through it briefly, but if you see, it's a simple case, AIDS and seborrheic dermatitis. Everybody knows it, it's a nice association. But author, what they did is they just put in another idea tool there that maybe seborrheic dermatitis is associated with early mortality or increased mortality in AIDS patients. It was a new idea, so they put in there. So the point is, as mentioned previous, it should not be a new thing, but it can be a twist on the previous things we already know. So title, they twisted it, nice. Authors and affiliations are important when you write. Please mention your institute as well, important. Intro, brief intro, and then abbreviations, as we mentioned, always write it fully. Methods we discussed about then, but in methods, primarily, what is the study, what is the sample, what is the design, so method. And in results, only big important component is the numbers. What is the statistical analysis show you, and show it there. And other than that, last is, as we mentioned in conclusion, you mentioned summarize your idea. And the main thing is it fits in the box which you guys have there. So that's a sample abstract I wanted to share. Next, please. Yeah, so these are all, many people among us are familiar, but primarily, what is the method section? In methods, we are primarily talking about these different studies. And intro can be a hypothesis. It can be anything, right or wrong, doesn't matter. Methods with different studies. If we go next, is next slide, please. Yeah, sampling. What was our sample, and describe the sampling. In the result sections, always a statistical analysis. We should write our results in using these result section, and basically biostatistics. Next, please. So that was all from my side, and I wanted to give a bigger picture of research abstract. And Dr. Deepak was my advisor and CRAB co-chair advisor as well. If you have anything to add, please feel free. Questions, I'll be happy to.
So thanks, Omar, for that outstanding presentation. And the things I would like to point out are introduction. So the one thing that I learned as a fellow writing a research abstract, day one, was you don't need to use grammar for research abstracts, meaning you do not need a complete sentence, a grammatical sentence in research abstracts. You need to convey your knowledge in as little as possible. So I would say the introduction should not be more than 1 or 2 sentences, because oftentimes you get hung up on the introduction and that's an entire paragraph. And that kind of can do a disservice, because most research abstracts are about maximum about 800 words or so, and it's difficult to put it together. And then again, methods have to be very succinct. So as much as you can write exactly as Omar shared with you, what is your study design, who did you enroll, or what studies did you look at, and things like that. Make it very clear on there. And the research should be the main things, not the nuanced research, not the nuanced results. It doesn't have to be every single result, but the main result that you wanted out of the study, those things are important. For example, if you're comparing racial and ethnic differences, say in lung cancer screening, you want to mention the racial differences. You want to mention ethnic differences. You want to mention socioeconomic differences. So it has to be extremely well organized, very well demarcated. so that you can read really fast through it, right? When we are looking at research abstracts, we are looking at ones that we want them to present orally. Research abstracts are not that much in our ACP associates meeting. So we want some of them that we want to present orally, but we need to understand what they have done. And oftentimes the mumbling and jumbling of the language kind of makes it difficult for us to know that. Dr. Wiseman, Dr. Chow, Dr. Kausa.
That was excellent. And I would keep in mind who your audience is, right? If you're talking to a general medicine crowd, right? We're not going to probably, if we have a very technical research study, just know your crowd, be careful, how can we relate to that? So that way we get something out of it. I always like a little bit, and I know the time is with the abstracts is a very short amount of space we have, but I like at least a sentence on limitations. I think that says a lot that someone has thought about that, and there's no perfect study out there. Every study has limitations.
Very important point. Thanks for bringing that out.
Thank you so much. Maybe for the sake of time, let's move on to the fourth section then. So this is the research poster, and Doctors Weissman and Nguyen are going to talk about that.
Is that all right if I bring slides up? Is that all right? I share screen? Pictures and words, say a lot. So I think having some examples. So I have several examples, and these are all from ACP meetings, by the way. I gave some of my own, and I'm starting with some maybe not so good examples first, and this is one of mine. And then I have some, I think I have the last 3 years of winning research posters that I like to present to you. And Cindy, please help me as we go along if I miss something. I think, the important thing that draws anybody into your poster is the title. And so you want to be a clear, succinct, catchy title if you can. Now, research posters, don't have the advantage always as a clinical vignette poster to being as sexy or fun always. But hey, you want to send your message. You want to be clear with it. Keeping in mind the font sizes, I don't think this poster did a great job in that. I had a lot of words here. So in general, for the title, that should be the largest font, usually the 72, and then your subheadings about a 48. And then, as I think Dr. Chow mentioned, you don't want a terribly small font, especially for your main components of your poster. I love 36 if you can do it, but most of the time you can't make a 36 and get everything you want to say out of that, but you will definitely but this forces you, I think, to be a little bit more succinct, bullet pointed, and exactly what Jennifer mentioned about not having to say the entire sentence. You have the liberty to doing just very brisk, quick points without having to complete a whole sentence. And I think that's an important thing. I think the bullet points are key, especially for a research poster. The color scheme has to really blend nicely. So it takes a little bit of effort to do this. And I'm definitely not good at that. Some people are really good at creating very pretty, nice, uniform color schemes. And as Dr. Chow mentioned too, as Dalvin mentioned about flow, similar to a CV poster, you should have a flow that you can follow easily. Most people would agree. I think the results is probably the most prominent part of your research poster. So they should be centered in the middle of your poster typically. So you want that to draw most attention. And then the different types of fonts, we talked about the sizes. Typically, Times, Calibri, Arial, I think we already mentioned these are the typical fonts that are used for most research posters, probably as well as CVs as well for the most part. And I think those are my main points that I wanted to say. So just to kind of go through this particular poster, this was a catheter-directed therapy for pulmonary embolism. The researchers here were trying to study, this was several years ago. Is catheter-directed therapy better than what was considered or is considered standard therapy for submassive at the time, what we called submassive or massive pulmonary embolism? Of course, our nomenclature has changed. It's a few years old now. And so did the author of this poster display the data well? I think the data needs to be displayed well. And honestly, I don't think, from my personal perspective, that even though, we got a patient characteristic table here, very nice. We got outcomes over all the groups, and then in the subgroups of submassive versus massive. I think it's there. I think it's just not displayed well. It's not eye-pleasing at all. Its font sizes are kind of mix and matched. A lot of spacing issues here. And that take-home points. Yeah, you can have a lot of take-home points, but I would try to focus yourself on one clear conclusion, one clear take-home point. And some people may do a conclusion and then have, final take-home points, something that the reader is going to take home with them from reading your poster, him or her. And so that's that.
I think it's really important to frame what you're trying to say. Like Dr. Weissman was saying, like if you could have really interesting research, and like with the case conference, it's like you could have a really interesting case that's multifaceted. There's always more things that you can talk about as somebody who has really thought about what you're presenting. But you want to frame it for your audience to make it digestible. And I think something that help with the results is also if there's a specific result that you want to hone in on, that's within your framing, you can highlight that, or you can circle that, or you can draw a visual cue to the reader's eye that would maybe make those tables a little bit more approachable as somebody walking into the poster.
That is an awesome point, Sydney. And here, like the authors really were struck by the amount of IVC filters placed in patients that were getting catheter-directed therapy as opposed to the stereotherapy didn't get, and that was important. But here you can't tell. Nothing is bolded here to highlight that particular point. So that is a fantastic point. And hey, that's going to save you in a lot of ways, right? Because you want to tell the story, and it's going to help you when you present your poster, and it's going to help the reader. That's a great point. Let's go on to another one. This one is a meta-analysis. Now, I know we get a lot of meta-analysis, and we got amazing residents from all over the area who put a lot of work and time into these meta-analysis, and they are complicated, and they take a long time. So I do know the work that's involved in. And this particular author chose to look at several studies in colchicine and the outcomes of coronary artery disease. It's certainly a very important and interesting topic. And, what do you guys think? They gave a background. They have a short methods section and how they did their searching. The results, it's kind of spans across 2 columns, which is probably okay, and a simple conclusion at the end. And I like this conclusion that it's kind of short and it's to the point. I'm curious what everyone thinks. I think this is the meat here on the right side of the screen. The studies that were included are important, but I would not have made that my center point. Again, your eye is going to be drawn directly towards the center of this poster. Obviously, a lot more could be done, I think, with a lot of words here. I think there may be some overlap in there's no need for duplication. So if you're recapitulating what's in your figure, no need to put it in the poster itself. Again, getting back to Sydney's point about highlighting certain points in your figure or table that you want to highlight, that would be enough. Any other suggestions on this poster?
Yeah, I think far too much emphasis on the number of studies, because honestly, that's what I can take home, right? I can't look at these very well. Whereas in a meta-analysis, this forest plot is the most important part of it, right? We need to see where this whole thing falls, and this should be occupying most of the space, and with some kind of red outline of things we want to focus on, kind of thing.
Absolutely. I agree. It's 100%. I would probably move this to the center point. Probably would have not included a whole lot here with this. Maybe move this table up to the right. And they would have had a much nicer poster.
That is what I think so.
And a little bit more balance color-wise if you put the middle, right? Because if you have blue, blue, white, as opposed to blue, white, blue, it maybe is a little bit more pleasing. People like symmetry.
Yes. Very good. Any other comments on this one? And keep me on time, because if I'm running too much, we'll keep going. So the next 3 are the winning posters for the last 3 years. This was not a winning poster, but I thought they did a nice job with some of the color schematics. Again, emphasizing. I don't know if they're necessarily emphasizing certain points here other than making it easier to read. So when you have a lot of data in a table, it can be really challenging for the reader to get a whole lot out of it. So just to kind of take you through this poster quickly, this was evaluating the impact of having advanced care planning discussions. This was done at a geriatric center. And they're looking, did having that discussion, advanced care planning, have an impact on patient outcome? And specifically where that patient died. So did the patient die at home, in hospice? Did they die in the hospital? What were the healthcare expenditures around the time of death. So it's kind of an interesting study, an important study. I think does having these discussions affect outcomes, right? That's an important answer, a question to answer. One other thing I wanted to highlight as thoughts were on my mind, in your background, yeah, it's important to kind of give a little bit of information as to why you did this, but also your hypothesis. What was your hypothesis or your objective? So that should be very clearly stated. So the objective of this study was to describe the advanced care planning. And I think it's fine to use shortened words if you have it written out somewhere else. We have it clearly noted on the poster earlier. Among CSA patients, and again, where it's, okay, 7 age of patients who passed away and examined the healthcare utilization. I think that's okay. Again, I'm always looking to try to use less words. Less words is always best. I like the font size here in particular, and it's consistent throughout most of the poster, which is nice. And that's kind of eye-pleasing. The use of color. And again, getting to the tables, your results section is dead center for you. You have the demographics table, who was included in the study, and you have your outcomes table. Very simple, direct. You can kind of scroll through here and say, okay, if I completed the advanced care planning, how many of those patients died in hospice care versus those who had partial or no advanced care? And then the take-home message discussion at the end. I think a little better job here. That's why I kind of showed this. Any thoughts on this particular poster? Things done well or not so well?
So I tried to in results, if I can, like some of the things, instead of writing it down, put it either in bar graphs or pie charts or things like that. So again, it's easy to read, easy to know, and then you're writing less, right? Because it still is a lot of writing in here, So if we can reduce the writing in any way by bar graphs or pie charts or whatever else is the figure you want to use in Excel,
Absolutely.
that will help a great deal.
Yeah, that is a beautiful point. And I think that's so important, right? Because I'm always a table person. Why? Because I need it better. But honestly, tables get boring. And tables are not terribly eye-pleasing. So if figures add a lot more to it. But man, you got to be good to do a figure, right? Figures are complicated and they're difficult. I've tried them many times. And yeah, you can do some relatively simple figures within PowerPoint or Excel and those types of things. But it takes a lot of thought and stuff to make figures that look like this. So this was an example. So this was one of the winners from, I think, 3 years ago. And this does, I think, a nice job of blending the look, the flow. It's not a perfect poster by any means, but it has a pretty look to it to begin with. So this was a study that was looking at, this was a retrospective study using IVIGG in immunocompromised patients. One thing I didn't particularly like about it, in the title, it doesn't even tell me about immunocompromised patients, and that was the whole crux of this study, that it was particularly in immunocompromised, and mostly those were cancer patients, either actively being treated or transplant patients. So that's the majority of patients in the study. So they're doing a retrospective chart evaluation on IVIGG. Does it have an impact on patients who come in with respiratory infections with those diseases? So again, the primary objective, I kind of like this. It gives you a little background, a little bit of, a straightforward objective, what their goals were. The materials and methods, or just to have the methods session, is important to describe the type of study this was, who was included, who was excluded, all the things that were mentioned previously. I think they do a nice job. It's clear to read. Tables and figures are nice. So who the patients were over here in the figures, the different types of, so if they had an identifiable infection, they listed it here in this figure. And going through their odds ratios and such from the outcomes, I think it's pretty easy, right? I mean, you can see their unadjusted, adjusted data, and length of stay, ICU, length of stays. I think it's pretty well, to me, well displayed data and their conclusions.
Yeah.
So it did seem to be, yeah, please.
I think the tables here are easier to read because they're, I guess, saying the same point, but they bolded and like made red the things that were significant, right? Like the p-values less than 0.05 were in red here. So my eye was like, oh, that's red. I should maybe look at what that line is. And so I was like, oh, okay. It's a little bit more approachable as opposed to like, and it helps me track the row a little bit better on the table. That's the problem with tables for me, is that like, I know that when I'm looking on Excel, I need to like actually move the cursor to slide over the line to make sure that I'm looking at the right column or the right row. And so having a visual cue and a poster that I'm not necessarily able to touch or interact with tactilely, then I can read it a little bit easier that way.
Absolutely.
It works.
Yeah, please.
Hi. Thank you very much for the great presentation, Dr. Deepak and Dr. Blood. So one skill that I found it useful and I recommend to residents is basically try to include the absolute necessary information in the poster, but at the same time have a lot of information basically in your sleeve and have practiced them even. So when the basically judges or people come around and ask for more information, because some people are more interested and want deeper level of like knowledge about what you've done, so that you're able to deliver it on the spot and you're not overcrowding your poster. So this is something that I think is useful.
Absolutely. No, Parsh, you make a good point, right? You don't have to have everything on the poster, right? You will speak about most of this. So you really want a nice poster that represents you well and is clean. And here, I'm sure they had many more things on this table one here that they could have included. I'm sure they had a load of stuff, but hey, they picked the most important things that we would find most important, and they listed them on the table here. So we weren't overwhelmed with data. That's a great point.
And the other thing is, in certain, like in ATS and CHEST, what happens is some of the data, say for example, if there is more delve into data, they usually put a QR code and say, scan the QR code for more of the information, or sometimes even much more detail about the design. In many of the international societies, that they allow that. So if that is available, use it. Not saying go out and try to get it for every single residency. It's not cost effective, but if it is there, use it. And that's where you can host a whole bunch of other data.
I think there's a good rule of thumb is that when you're practicing, and you should, I think Dr. Bajwa said, practice. That is very true. When you're practicing presenting these things in under 5 minutes, you become an actor. A good presentation is theater. You should be telling a story, and it should be engaging and interesting. And so you're going to pick and choose what you tell in those 5 minutes. And while you're practicing, you realize there's parts of your slide that you're not using at all. You have to rethink whether that's important to have on your poster if it's not really something that you're pointing out and seems important to your work. Now, sometimes you do want a little more data than, it's not only the positive findings for sure. You want to be able to answer questions when someone says, yeah, but did you consider this? And you say, yep, see, we corrected for these factors here in the fine print, and show them that that's on there. But the biggest mistake I see with both the clinical vignettes and the research presentations is just way too much information for anybody to process. And you're trying to talk as fast as you can to get it all out. And nobody learns very well that way. So it's good theater. Act it out.
Just like your presentations on the floor, right? Like if you're to your attending, you have to figure out what is actual pertinent information that's good to talk about right now, but you should know the patient inside and out.
Great points. I would like to hear other people's opinions on having the reference section on the poster. I think, and if you have a QR code or something that can reference lead you to the references, I think that's better. This one doesn't have it. I like getting it off the poster personally. I think if you're going to make the font so small, who's going to read it anyway? And then you can bring it with you in the piece of paper, ready to go. Or if you have a QR code, that's my opinion. I don't know what the other.
And maybe we could wrap up this section.
Sorry,
but I do think that no, you're doing great. I do think that I think that depends on the meeting a little bit too. Sometimes there's really a key reference. Maybe you've used some technique that somebody else developed, and you really want to give credit to them or whatever. So I think it's okay to have a little small font at the bottom that no one's really reading, but you, again, can point to and say, this is who did this work. But you certainly don't want a comprehensive list of references that are going to take up a big, half a column or something like that.
Yeah, very good. Very good. So I have a couple more examples. We don't have to go through those examples. We can open it up if you want, Colleen, some people to have questions.
I think let's try questions for a little bit, because I do want to make sure that if people have questions, they've been holding them and that they get a chance to ask. So thank you. If we can pause there. I'm going to tell you a few take homes that I'm going to take away from what I heard from our colleagues tonight. So one is you'd be surprised. And what I mean by that is that, you'd be surprised at the posters that you see, that it doesn't have to be a miracle. It doesn't need to be a Nobel-winning research. But if you learn something, you can probably craft that into a lesson for other people too. So just do it, as the Nike commercial says. The other things that I wanted to take away was words. Like, words are bad. Too many words are really hard to process on a poster. Your abstract has to contain enough information so that the reviewers know what you did and the important things that you found, but they won't have everything there. And that's always going to be in prose. And then your poster is going to be bullets, fewer words, important points highlighted. And, pros and cons, different people you've heard talk about whether they like the punchline right up front or they want it to be a little more a surprise where you read from left to right as a story and get to the punchline at the end. That's more of a style sort of thing, and you can work with your mentors. I also heard a couple comments on authorship. I think this is particularly, I think that it pertains to both areas, the research and the clinical vignettes, and that you always want to be really clear about authorship right at the very beginning. It's a million times easier to say, this was a really interesting patient. And I know we have 4 different consult services involved. I'd like to write this up for the Maryland ACP and present it as a clinical vignette and make sure that nobody else is also planning to do that. And I'd like to be first author. And, that's better than having 2 people submitting and then getting in a fight. Or in the lab, you're picking your parts of your research that you're going to write up and someone else thinks that they own that. Again, you want to make that really clear in the beginning. And speaking of authors, please make sure that your co-authors all agree to the submission and have a chance to review it. I think several of our presenters talked about, make sure you have enough time that people whose names are at stake, their names are on these posters, that they've also had a chance to review things. And then finally, I also heard several of our speakers talk about, making sure that you get someone to practice it and to proofread it. That's one of my personal pet peeves when I'm judging posters. If somebody's kind of been a little sloppy and there's a lot of misspellings and things don't have units, and then I feel like they didn't really take the energy to make sure that I was going to learn a lot from that poster, and it's not as exciting to me. I wonder if other people have some take-home points or questions.
I had a question, if I could jump in. I'm one of the residents in Luminous Health, and I was wondering if you guys had any advice on kind of what to use to kind of make figures and make it look more attractive in general. If there's any tips on that to kind of use less words and use more kind of more directive imaging.
I wonder if our chief residents have advice on that. I feel like there's more tools. So I'm old school PowerPoint, which is pretty limited in those things, but I've seen some gorgeous posters. So I bet some other folks might have advice.
I will say that I am not somebody who is very graphic design savvy. So when I did my posters for ACP, I really just made graphs with Excel, just to add some color and to add a visual element so that I could explain. I think, we saw a lot of examples for timelines and stuff like that, which is like a great graphic representation. So it saves you a lot of typing out and bullet points for that. I think I have seen other residents who are maybe a little bit more artistic sort of create graphics with if you have an iPad or an Apple Pencil or something that you can draw on a notepad and you can screenshot it and use that image in your poster. And then I think the other thing that I saw on Maria's poster that she actually that was like featured in one of the PowerPoints is that she made sort of flow diagrams and schema. So if you have like, you know, say you have like 3 main takeaways from like, or a subheading or whatever, you can use like a big bullet and then like arrow somewhere instead of being like 1, 2, 3 to make it a more visually appealing, more graphic poster.
Yeah.
All right, thank you. That was really, really insightful. Thanks.
I have an iPad with an Apple Pencil, and I use like Notability sometimes for that. So I can use like highlight, or I can use like different colors, and then I screenshot that and put that on the poster.
Also, I wanted to add a couple of things to this question. You can certainly make your graph from Excel, but as PowerPoint has the ability that you can actually draw, it has actually a lot of flexibility. You can make a lot of different flow sheet. You can have a timeline, those kind of things. But Canvas is a good one. Usually Basic Science Lab, they use it. I used it for many years. I was actually a basic scientist. So a lot of drawing comes from Canvas. So if you know how to use Canvas, that's very good. But if you do simple thing, please make sure you use the appropriate graphical presentation. Which one goes to pie chart? Which one goes to bar graph? So that's also important. Which one is a histogram, right? So where you should have a space in 2 bars. Histograms usually doesn't have, but if it is a bar chart, you will have. So, make sure that you are using the appropriate tools. One other thing that I should add, when I learned how to present poster from my lab, I was told 2 things. One, poster is a complement. What you can say should not be in the poster. Poster is something that you cannot say, right? So poster is more of illustration, showing graphs and the data that you want to show, how you did it or what is the things. That can be very brief in the poster, and you will be telling more. When you are presenting, this is what I was taught in my, during my PhD, that if the audience is looking at the poster and not listening to you, that means you have no interesting things to say. So they will be looking at you, and then you will guide them when to look at the poster, instead of they reading the poster and not listening to what you are saying. So you need to make a fine balance, that who is in charge. If you are the presenter, you tell them that when to look at the poster. So the graphs and all those graphics that should be the main point should be in the middle, that Dr. Chow mentioned. And so I think this is a great session. You learned a lot of things. There's no one right way of doing it. Each conference has their own rules, that how you will have to do it. Remember, if you submit a paper, you cannot submit one paper to 3 journals. You will have to reformat 3 times each time you present, right? So same thing, follow the rules of the conference. But these are the basic things that everybody discussed. I think this was very valuable, very helpful. Thank you.
Any last comments?
I would like to add one thing. Now, sometimes it's very expensive and very difficult, especially if you're traveling to do paper posters. There are very nice Canvas options available, which are not that expensive. So find out from your library if they do Canvas printing, because you can fold it and take it to your presentations, and you don't have to worry about paper and how you're lugging it from one area to the other. I know that our library allows it, and I'm sure Hopkins also. And actually, it's cheaper than paper, is what I found out when I first printed it. So things to think about.
Can I say one thing, Colleen, too?
Of course.
Recently I was using Microsoft Forms, which I think was helpful for me. It used, I think, some kind of AI technology to help you better. So if you have access to Microsoft Forms, that may be something simple other than Excel, that you can help make various figures look kind of really cool and snappy. The last thing I wanted to say was about publication. I think some comments came up early in the chat about publication, especially when you're dealing with case reports, because they are few journals that I would say reputable journals that will do case reports. And it's important to get a list. And we developed a list in our program of avoiding the predatorial journal, and I would just highlight that because you really don't want any, and hopefully you will take this poster to the next step and publish it. It's important to get the information out there. I think it's part of all of us to contribute to the medical literature. But be careful. There are journals out there that you do want to stay away from. And I'd be happy to share our list if people thought that would be useful, especially for case reports, which sometimes is hard to find.
That would be great, Dave. And I think the ACP's new journal, I think it's called Journal of Clinical Cases.
Correct. That's a great one.
Okay, great. Just making sure I didn't botch our own organization.
No, right.
Okay, good. Well, listen, we are at 8:02, which, there's a lot of people are really excited about this topic. We all enjoy doing the posters and the abstracts and going to scientific meetings. I hope you'll all join. If you're a student, come to the Williams meeting. If you're a resident, come to the Mulholland Muller meeting, come to national meetings in your specialty of interest and so forth. Get help from advisors and mentors. And I think all of us here on this call would be happy to help at any time too. Thank you all so much for joining. Please join me in thanking our presenters tonight. Great job, everyone.
Thank you.
Have a good night.